rejoin us now, and I'm very interested to hear her next talk, the technology for new insulin pumps and prescribing them. I hope that I feel that this is basic. I doubt it, but she's going to give us the basics. Thanks, Dr. Thompson.
All right, I'm really excited to give this talk on insulin pumps and technology because although you may not be managing these patients, you're going to see them in your clinic, and I think it's really useful to kind of know, what they're doing and what all this stuff means. What they do and how they can help. And I'm going to talk to you about, who would be a good candidate for an insulin pump or a continuous glucose monitor, and the process of training these patients and following them and educating them, and then how we can use this information in our clinic. Okay. So how common are they? We routinely think of insulin pumps and continuous glucose monitors in type 1 diabetics. In type 1 diabetics, it's probably estimated at 30 to 40% of patients with type 1 diabetes that use an insulin pump. And it's probably increasing. We have this really excellent database called the Type 1 Diabetes Exchange, where we have access to a lot of information from type 1 diabetics across the U.S. And a recent paper, of 16,000 participants showed that maybe 60% were using an insulin pump, so definitely increasing. We know that in type 2 diabetics, use of insulin pumps and continuous glucose monitor technology is increasing. And as Mary talked about, just here recently, the Freestyle Libre system, which is a type of continuous glucose monitor, those are becoming more, increasingly used in type 2 diabetics. So we have to develop an understanding of these devices and what they actually do and what they can do for us. So I always, we're living in an era where technology has changed a lot for diabetes. So this was 1980, here on the left. This was the first insulin pump. The first insulin pump was actually taken from these portable chemotherapy pumps that patients used to use, and they kind of reformatted it and made it an insulin pump, and that's how people used to use insulin. It was very tedious, and it only had one basal rate, and they had to dilute their insulin. And now you can see here on the right, this is what our new technology looks like. These are touch screens. We have glucose data. This is this continuous glucose data every 5 minutes on the screen here. Some of them don't attach, some of them are detached. They talk to your smartphones, they do all kinds of stuff, so they're very progressed. And we're going to talk about the basics. So what is an insulin pump? Now, I see patients all the time. I get these notes from other providers, and it says things like, patient's glucose controlled by insulin pump. It's like, well,